Not one child should ever die because those bastards closed our hospital.
Health systems in rural America are struggling. Many are losing money, and over the past decade, more than 100 have closed. During the debate over the One Big Beautiful Budget bill, some lawmakers expressed concern that Medicaid cuts would threaten rural health systems, which rely on those payments to keep their doors open.
Rural providers, especially our rural hospitals and nursing homes, are under great financial strain right now. When these facilities close their doors, the people they serve are often left behind without access to health care.
With that hospital closing, I either have to go half an hour one way or go all the way to Bangor. My life is at risk if I go into cardiac arrest, and from both sides of my family, there is a serious risk in about 5 to 10 years of that happening. We went from local little tiny doctors' offices to government-controlled, insurance company-controlled, massive corporate,
here you go,
doctors' offices and hospitals. And now we can't get doctors. We can't get good healthcare, broadly speaking.
Cool hat, man. Every dollar that the Republicans took from Medicaid and rural hospitals by extension to spend on building bombs to then go and bomb hospitals in different countries is a dollar that they stole from you and those hospitals that would have treated you were you to have cardiac arrest in Bangor, Maine. I hope that helps. It's not going to. Hospitals help generally. Wearing the merch of the guy who is going to be potentially your own personal angel of death while complaining about America's healthcare system is a level of irony I can barely even comprehend. And just to be clear, I wish no death on chronically ill-informed people who continue to vote against their own self-interest. To some degree, they have all been just criminally duped into doing this to themselves. I want Americans to get health care, okay? I want that. They don't, okay?
She saw that in Indiana, there are 12 rural hospitals projected to close due to the big, beautiful bill. Is that correct? Yes, unfortunately, is correct. 12 rural hospitals are expected to close in Indiana. Is Indiana a red state and voting for Trump? Yes. Did Indiana vote to spend money on military and deporting brown people? Yes. Is Indiana going to learn a hard lesson because they are a red state? 12 rural hospitals are going to close. Also, millions of Americans are going to be cut off Medicaid, SNAP benefits, which affect red states the most. So is Indiana getting what they voted for, like Texas and this tragic flood? Like farmers, cattle ranchers, coal miners, truckers, federal workers who voted for Trump, Latinos who voted for Trump, Cubans for Trump, Venezuelans for Haitians for Trump, Mexicans for Trump. Yes, they're all getting what they voted for.
Never forget that elections have consequences. For one city in Nebraska, they're learning that shit the hard way. Curtis, Nebraska has a population of 806. It's the kind of place with a single traffic light, one health clinic, and a fuck ton of American flags. And in 2024, over 85% of them voted for Donald Trump. Now, their only medical clinic is shutting down by September 30th of this year. It's the kind of place people went for everything. For checkups, blood work, urgent care, you name it, that's where they went. And once it's gone, we're looking at a 40-mile round trip just to see a doctor. So who have they decided to blame? Not Trump. Not the Republican Party. They're blaming the hospital executives. Like this is some sort of isolated business failure and not the direct result of the GOP's big, beautiful bill that gutted Medicaid and rural healthcare funding. That bill slashed nearly $1 trillion from Medicaid. Small-town hospitals like Curtis's, they were the first ones thrown under the bus. And the GOP knew it was coming. And now look where these people are. Sick, stranded, and still making excuses for the guy who signed their death warrant. But this is the cost of voting for the con man, guys. Your taxes don't get you care. Your vote doesn't get you help. It just buys you a slower, more painful collapse. So when you say you support law and order and protecting life, but watch your hospital close down under a president you put back in power, you're not just a voter. You're the getaway driver.
Rural America voted against their own interest. They shared cuts to Medicaid, believing that those cuts would only affect someone else, but now their own hospitals are now shutting down. This is what happens when people vote based on hatred instead of voting for policies that will actually help their community. So let's get to see more. Please like and hype the video and let me know your thoughts in the comments, alright? Let's get into it.
Rural America is facing a full-blown maternity care crisis and no one's coming to help. More than half of all rural hospitals in the United States have no labor and delivery services. And the ones that do, nearly 200 of them are at risk of shutting down maternity care entirely. These hospitals aren't cutting services because they want to. They're doing it because they're losing money every single time someone gives birth. So here's the financial reality. Medicaid pays for over 40% of births in rural areas, but it reimburses less than what it costs to provide that care. So that means hospitals lose thousands per delivery. In fact, even if a rural hospital has a fully staffed maternity unit, it can still lose money just by keeping it open. So this isn't just bad business, it's a public health disaster. When rural hospitals close their OB units, families are forced to drive over an hour to the nearest delivery center. That's dangerous. Maternal and infant mortality increases, preterm births increase, C-section rates go up, and rural Black and Indigenous women, they face the highest risk of death and complications. So even when hospitals try to keep their services open, they can't recruit and retain OBs, midwives, or even anesthesiologists because the pay doesn't match the risk and the funding simply just isn't there. So this isn't truly a workforce problem, it's a payment problem. There's no current federal payment system that guarantees maternity services will be sustainable in rural hospitals. That's the issue. And this isn't just anecdotal, right? So all this data is from the 2024 report by the Center for Health Quality and Payment Reform, which is called No Cuts, No Care, The Crisis in Rural Maternity Care. Here is the truth. No OB means no deliveries. No deliveries mean no care. And no care means more deaths. If we don't reform how rural maternity care is paid for, especially through Medicaid, we're going to keep watching hospitals cut services until there's nothing left to cut. So this isn't just a crisis, it's an absolute policy failure. And we have to say it louder. No cuts, no care.
The nearest hospital to my small North Carolina town is 30 minutes away. But many rural hospitals have been closing due to lack of funding. And if more people get kicked off Medicaid because of the bill that the government's trying to pass, then more rural hospitals will close and people will have lack of access to the healthcare they need.
Georgia hospitals are closing. Now, I probably lost half of you because you're just like, what do I care? I don't live here. And also, what does that have to do with me? But guess what? Newsflash, not everyone wants to or can afford to live in Buckhead, Sandy Springs. So people in rural Georgia are really feeling this. I'm a healthcare recruiter, and I was recently laid off from a huge hospital out here in Georgia due to a hiring freeze. Are Georgians less sick? Do the math. They're projecting about 30% of hospitals to start closing, and the reason is slim margins. These hospitals are not making money. They have been operating in the red for some time. Now, the reason is people simply cannot afford healthcare. Also, Georgia has not expanded Medicaid. People are simply left without insurance. Them shutting down the hospitals is not nothing. People literally have to now schlep to hospitals in larger cities or larger towns. Gas is already $5 to $6 a gallon. Plus you got to pay for parking when you get to the hospital. Plus the co-pays, plus the yada, yada, yada. The bill is already $1 gazillion. Let's be real. Or worse, people just don't go to the hospital and they just wait it out. This is someone's auntie. This is someone's mother. This is someone's grandmother. This is someone's loved one. So when I tell you to get out and vote, this is why. This is why.
Hey, y'all, just coming through right quick. Listen, according to Augusta Hospital News, there are 3 hospitals in rural Virginia that will be closing. They will consolidate And they are reporting it is because of the one big beautiful bill. Y'all know that's the bill that Donald Trump was pushing so hard back in May, June, and July. He wanted it passed by the 4th of July, but it didn't happen then. But eventually they went on and passed it. Big Beautiful Bill Act, right? So that cut millions and millions and billions of dollars from Medicaid. And they are saying that because of these Medicaid cuts, these hospitals will not be able to sustain. I told y'all that. I try to tell y'all that. Go back and listen to the video. Go back and look at the videos. I told y'all that Medicaid was very important. The dollars that go out there keep a lot of these rural hospitals open. And if they cut those dollars, I said, guess what? Hospitals will close. So this is in the state of Virginia. This is going to be happening, across the United States. This is not going to just be in Virginia. And these are facts. Now, TikTok can say what they want to. Go do your facts. Fact check. It's out there. Do your own research.
I don't think a lot of people understand the volume of people that are going to die if Medicaid gets taken away. That means elderly people who use Medicaid to pay for their nursing home. I guess they're just going to throw them out onto the street. I'm not quite sure how that's going to work. That means people who use Medicaid to pay for their chemotherapy can no longer access it. That means people who use Medicaid to pay for their diabetes care no longer can access it. And that means that I think it's 4 out of 10 births in America not going to be covered anymore because 4 out of every 10 births is paid for by Medicaid. And one thing that I don't see a lot of people talking about is the people who are not on Medicaid yet, but would need to access it in the future. Because those people, you've already signed their death sentence as well. There are a lot of people in this country who have stayed with abusive family members or stayed with abusive partners because they need financial assistance. And going out on their own, they can't afford it. When you take away safety nets like Medicaid, guess what? You're signing their death warrant. Because then they're in the position of, do I stay and have access to private insurance, but maybe die by the hands of my abuser or through negligence of my family members who are supposed to be my caretakers? Or do I go out on my own where I can afford nothing, not housing, not food, and definitely not medical care, and then just die that way?
Hey y'all, it's been a minute. Just been busy. Went and saw some family this weekend. My Trumper family. They are, it's hard because they're really good people and they do a lot of good shit for their community and they really try and help out. And a few months ago, my cousin's wife, we were talking and I said, I'm not trying to get political. I said, but I know that you're a special education teacher. Like, what's going to happen when they cut this funding in the Department of Education? And that's when she had told me, she was like, well, I don't really know what the Department of Education, like how that's going to impact my rural school. And I'm like, okay. I said, well, rural schools are funded usually by more federal funds than they are state funds because you guys don't have a lot of tax revenue that you can pull from in order to fund your schools. So, lo and behold, we get over there and she goes, oh, we got the notification that our school district has to cut $2.2 million because of the lack of Department of Education money. And I said, yeah, I was like, that's really sad. I was like, it's going to be really, even harder when your local hospitals go away. And she was like, well, what do you mean? And I said, according to Governor Markey, Senator Markey, there's a list that came out and here's a list of 14 hospitals. And during our time there, I ended up giving her this list of hospitals. And as I'm in the other room doing something, she gasped and she was like, oh my God, Sunnyside Hospital's on here. And I said, yeah, Sunnyside Hospital's on there. I said, look at all the other hospitals that are on there. I said, what are people going to do? And she was like, well, can I ask you a question? She goes, why do you carry around lists about things like this? And this is where I, to rein myself in and go, well, what I want to say is, because I want people like you to be informed because you're listening to my fucking Trumper cousin, who's your husband, and taking all this shit at fucking face value and not looking for anything for yourself, as far as I can tell. But I said, I encounter a lot of people who sometimes don't understand how the system works. And so they reside in areas and communities that absolutely survive off of federal funding. because they don't have enough tax revenue within their cities, counties in order to fund their schools, have their own hospitals, so on and so forth. You know, I said, I hope this kind of gives people a heads up that your community is about to really take a blow, and you're going to have to figure out what you're going to do in case of an emergency. Should you have an extra medical kit at home? Medical supplies? Are you going to pay for a medevac service, an emergency lift service now to take you to Yakima? Because Sunnyside and Yakima are about 40 minutes apart, 45 minutes by the time you got to Yakima Memorial, and then you'd have to get an ambulance there. Their friends this weekend their firefighters were talking about how they're getting ready to lose probably another fire station. And that he looked at the staffing and capacity at the 90s to now, and it actually has reduced. And I was like, yeah, you know, because we don't have a federal government that, and government in general, that wants to fund human services, right? Like, and it's just like you could tell they get uncomfortable, and then it just is like, nope, they're going to block it out. So I think like a lot of us have realized and recognized that nothing is going to change in the minds of these folks until that pain comes for them, till it comes for their community in a way that can no longer be ignored. And it pains me. It pains me. The things that my cousin's wife says and how my cousin is sometimes are like the antithesis. Like I don't know. It's so weird. And I think that there are people that, you know, and I know a lot of people use the term waking up, but I think sometimes there are people out there that are sympathetic, but they're not empathetic. They don't go, I felt that kind of pain before, and I don't want somebody else to feel that kind of pain. So as a society, we should do something to make sure that people aren't experiencing this kind of pain. Like, I just don't know if that resonates with a lot of people. And I just think so many people, like my cousin he's a very much, as much as he's helpful, he's also like, I will help, but I'm still a me, myself, and I. And I understand it, right? Because we don't live in a society that is built around humans. We live in a society that's built around the economy and money.
Rural America was told programs like Medicaid and even SNAP was helping Black and brown people. But in reality, the majority of people who rely on those programs are in rural red states. And our social programs do not belong to one particular group. They help millions of Americans regardless of race, background, or even political affiliation. They help children, veterans, the elderly, the disabled, single parents, and low-income earners. And at many rural hospitals, they rely on Medicaid funding to help keep them open. They operate on a very small budget because they don't have large patients like hospitals in the big cities. So when those funds are reduced, hospitals start laying off people, services are being cut, maternity wards close, emergency rooms reduce staff, and eventually some hospitals, they shut down completely. And when this happens, regardless whether someone voted for Trump or even not, the entire community pays a price. Imagine a pregnant woman going into labor at the middle of the night and having to travel long hours because her local hospitals no longer delivers babies. Imagine someone who suffers heart attack or even stroke having to drive miles away just to receive treatment. And this is why elections really do matter. But most of the times, politicians, they spend more time blaming someone else instead of explaining how policies will affect local communities. And that's how people support policies without fully understanding the consequences. People should stop voting based on fear, anger, resentment, or even cultural war politics, and ask how policies will actually affect my community or even my family. People should always be willing to question the leaders they support when policies are not producing results as promised. You know, supporting a politician does not mean supporting every decision without question, because at the end of the day, illness does not care who you voted for. So thank you so much for tuning in. Be sure to like, subscribe, and share. Have a good one. I'll see you in the next video.